Hey guys, it's Chris again. I just wanted to do a little bit of an updated video. I got my surgery actually a week today, I believe. Yeah, Wednesday. It's Wednesday. And I'm still wearing my vest and everything. I still have my tubes in until Friday. I had really large swelling on my left side, which caused me to have to kind of wait a couple more days to get my drains taken out. But um, I'll just show you the results. Basically, right now I am wearing the compression vest that I bought, which Dr. Fischer says was way nicer than the ones that they had there, which I bought through contourmd.com, and it was only $30, so it's a pretty good price. But I'll show you. The nice part about this vest is it's a full length vest, and it's got the butterfly clasp right here, so um, it's really easy to get on and off, and it also has the adjustable straps on the shoulders. So um, that's what it looks like right now. You can tell over here I got quite a bit of bruising. I actually didn't have much bruising on my left side at all. It's great. So as you can see, she got me pretty flat, and I haven't taken the stuff off my nipples yet. I'm gonna get all that stuff done on Friday. So overall, though, I'm looking at great results from this whole experience, and these the incision marks are actually really small. They look big, right here, but if you actually look at them up closer, they're pretty small. So I'm excited to see how it's gonna all heal up. So let me get back in this get up here. It was really nice when I went into Dr. Fisher's office. Everybody was already pretty much prepped, ready to go for my surgery. So everybody was already in their garb and everything, and I got a um, little checkup or consultation appointment with Dr. Fisher and her nurse before I actually went in and had the procedure done, and they are thorough with everything you could possibly want. So if you have any sort of questions about what healing time is like, what's it gonna feel like when you're getting out of surgery? Is it gonna be? Are you gonna be in a lot of pain? Are you gonna be swelling? Are you gonna be? They're really good about answering all those. And luckily, when I got out, um, they had me on some good drugs, which was good. And I couldn't feel my chest for about the first 3 or 4 days, so I wasn't in a lot of pain at all. I actually stopped taking my pain pills that they gave me 3.5 days afterwards, and just switched to 1,000 milligram Tylenol, which seems to be working just fine. And really, the only pain that I've had this far is actually the incision marks where they cut me open, and there's some weird sensation around my nipples also, but it's nothing that's really irritating. It's just kind of weird, I guess. I don't know. The only weird part that I've really found was when they actually stretched my skin down and took off excess skin that I had there before. Um, I get sensations in places where my skin used to sit, but it's actually in another place. So that's really weird for me because I'll try to scratch one place and it's actually not there. It's actually a couple inches over. Um, so that's kind of a weird thing to get used to. Sleeping at night, the only hard thing is you have to sleep on your back. For me, I'm a stomach sleeper, so they gave me some Ambien with my prescription and everything. So I've taken a couple of those, just trying to get a good night's rest. And day to day, I mean, by the second day, I went to the Baltimore Aquarium, and with my mom and my fiance. I've been up walking around. I haven't been really sitting down except for the day of surgery. When I got out of the hospital, I just kind of laid around after that because I was still kind of under anesthesia and kind of out of it. But literally, I went into the operating room, and the table doesn't look like a regular operating table, and they were playing country music, and it was really just a relaxed atmosphere, and everybody was really friendly, and it wasn't very intimidating. It wasn't very hospital like, which I really liked. So the anesthesiologist met with me also before I went in the operating room, and she was the one who was there putting in my IV and everything. And she is really good because I didn't feel anything when she did my IV. And she gave me one of the relaxation drugs or whatever, and the next thing I know, I'm waking up from surgery. So I didn't have to do any countdown, any sort of, weird thing that they usually make you do, you know, when you go into the hospital. It was like I was out and then I was waking up and I was all done with everything. So um, recovery was pretty minimal. I just sat around, watched some TV. I spent probably about an hour and a half in the recovery room. I actually took me about 45 minutes just to wake up because I'm kind of stubborn like that. But overall, they've been absolutely great. They called me the day of my surgery. Both the anesthesiologist and Dr. Fischer asked how I was doing. I went in for a follow up the next day, and they wanted me to come back in the third day just to make sure my swelling on my left side went down. And they called me after that and made sure everything was okay. So they're really good about, you know, checking up on you, making sure, you know, you're comfortable and that everything is okay. If you need any drugs or, you know, anything to help with the pain, they're willing to prescribe that sort of thing. Excuse me. And so overall, it's been awesome. Like I said, I get my drains out in 2 days, so that's really the most annoying part about this whole thing because, as you can see, they're out of both sides. This side's really dark compared to this side. This was actually the side that was swelling a lot more. So this is all just dead blood still coming out of me and such. And um, the only really bad part about these vests, I mean, this one's a nice one. I like this one, but um, I'm a pretty big guy, so I had a little bit of rubbing on the back side of my armpit, so I had to put in washcloths and stuff, and that really helped with that. But you know, these things aren't the most comfortable things in the world, and it's weird because it's not quite a compression shirt like I used to wear, but it's kind of sort of there. So I'm getting used to the whole, you know, letting my skin breathe and all that, and realizing that I don't have a chest anymore. So I'll do another updated video once I get my drains out and I get all the scars off, and you know, I'm pretty much out of my compression vest, and we'll start seeing how results are looking. All right, thanks.